Within healthcare, though, it's not always the case. Because healthcare is so sort of shrouded in mystery, secrecy, and complexity, it's difficult to know even what something might cost, and even tougher to do with quality. But as you're able to get new types of analytics that are coming to be available to the public, different employers are able to start running procurement in healthcare similar to how they would do any other area of their business. And as they do so, often we find that providers who are very high quality achieve that by doing high volume. And if they're doing high volume, they don't have to charge as much in terms of cost. Ultimately as well, you have to look at appropriateness. So if a provider is doing a lot of, say, services or surgeries or whatever it might be that may not be totally necessary, you can improve cost by not getting care, which also is ends up ultimately being high quality for the members. So there's a number of different lenses through which we can look at that, and they do start to coalesce.
Okay. What do members want? I mean, we talk about high quality, but what do they define that as?
That's a great question. So if you ask any member, any of your friends or even family members, which doctor do you want? They all say the same thing. I want the good one. I want the good one.
Sure.
And now what does the good one mean, and how do you define that? Well, it's different for a lot of people, but I think most people can agree on a few principles of, I want a physician who is, if I have any control over cost, I'd like it to be reasonably priced. I'd like to know that they're not going to do an unnecessary or highly, a risky surgery or procedure on me. I'd like to know that they're looking out for my interest and not sort of another interest. And as we sort of move in that direction and try to bring that to the forefront, we're able to really make better decisions. And ultimately, that's what members want, is simple, easy, valuable decisions, and they want to be able to trust that the healthcare they're getting is what's best for them.
Are we any closer to really figuring out what things cost?
Yes, finally, and it's a great question. I mean, I think in 2007, some of the first transparency companies started coming to the forefront in the industry, saying, hey, we can help you to figure out what costs are in healthcare before you go to the physician, which prior to the mid-aughts wasn't something that was really even talked about very much. Over the past decade, as we've gotten more and more sophisticated, employers really are getting a good idea around what things cost. It's not easy. It's quite challenging to get that data, and oftentimes even more challenging to make sense of that data. But progressive leading employers today are able to access a number of different types of analytics and data to look for the cost, the quality, and going forward, we're just now on the very front edge of being able to look at appropriateness, which would be a third lens of, is the care necessary or not, regardless of what it costs and whether or not the technical ability of the provider is good. Is it appropriate care? Is it necessary? And now we are getting to those decisions.
You talk a little bit about fiduciary duty at
Yes.
meetings. Expand on that.
This is a really compelling area because it's not a new area. So every big employer is what you'd call self-funded, which means they pay for their healthcare claims themselves. And all of that is governed by the same law that governs 401k, which is that the law is called ERISA, and it says that every employer who is managing a pension or a 401k needs to take care of those employee dollars. Makes perfect sense, and of course that's the law that governs it. In the past few years, though, many of sort of the leaders within the legal structure and those who follow risk have started to see that most of the risk, which historically has been on mismanagement of the 401k, is now potentially being offset and being refocused on mismanagement of the healthcare claims and the healthcare dollars. Today, there are many times more employee dollars going into healthcare than there are going into your retirement. In the past, over the past 50 years, it's almost always been the inverse, is that you put way more money towards retirement, pension, 401k than you were doing on healthcare. But now that ratio has been flipped. And so more and more, I think people are looking at what employers are doing to safeguard those funds on the healthcare side. the same way that ostensibly they're all very carefully managing the dollars on the 401k and pension side. And when you look at it with an objective eye, it seems like the amount of scrutiny and due diligence being applied here is actually greater than what's over here, even though the risk and the dollars now are flowing to this side of the house.
Do you think that employees are buying into this, that this is their duty, do they get that?
I sure hope so. They all understand the necessity of being careful with 401k, that those are sacred, sort of ERISA regulated funds. And once they start thinking a little more carefully of wait a minute, we need to apply that same due diligence on the healthcare side. The difference though is you don't have the Wall Street Journal publishing a report saying that a third of 401k dollars are lost, but you get roughly analogous reports coming out on the healthcare side. We all know that healthcare has there's a lot of things occurring on the healthcare side that aren't necessarily in everyone's
Really
best interest.
expensive, yeah.
Really expensive. We know there's waste there. There's different reports coming out about fraud. Well, if this is all occurring, we need to be amplifying the amount of due diligence and fiduciary safeguards that we put on that side of the ledger. And my hope is that, yeah, a lot of employers are taking notice and taking action.
It's always great to see you here at this meeting.
Thank you.
Why do you come?
I love coming out here because there's a ton of thought leaders in this area at the World Healthcare Congress with a tremendous amount of kind of concentration around what are next generation cost strategies, capabilities, and controls. We have people who have done amazing things for everything as high as major state healthcare plans to individual employers from all over the country who are getting real results. And when everybody comes together, it's a great opportunity to learn and network.
All right, Lee Lewis, thank you so much.
Hey, my pleasure. Thanks for having me.
And I'm Mabel Jong. Thanks for watching. Stay tuned. We have more to come.